My name is Victor Francisco Gomes. I am a member of the National Health Research Ethics Committee of Guinea-Bissau, which is under umbrella of the National Institute of Public Health. I am located at the Ministry of Health.
My name is Ester Delgado Oliveira. I'm from Cabo Verde. I'm a technician in the Independent Health Regulatory Authority, ERIS. ERIS is the national authority responsible for technical and economic regulation for healthcare establishment, the pharmaceutical sector, and also the food sector. We are going to present the team challenges related to independence of research ethic committees. It is a case study that involves two decisions made by two different ethic committees in the same protocol, the protocol for the use of the BCG vaccination in the context of COVID-19 pandemic.
The BCG vaccine was developed as an anti-T vaccine in the 1920s. The BCG vaccine was first given to the humans in the early 1920s, but its use did not become widespread for decades, following continued research into its safety and effectiveness in the 1940s and 1950s. A review of evidence in the early 1990s concluded that BCG vaccine is reliable in protecting against tuberculosis. Even so, the vaccine is still saving lives. Research indicates it is around 70–80% effective in protecting against the most severe form of tuberculosis. During its long existence, a set of evidences has emerged to suggest that BCG vaccine may also offer benefit protection. And this was shown in studies done by Professor Peter Abbey in Guinea-Bissau, who found that BCG vaccine has non-specific beneficial effect also in protecting against other infectious diseases. The evidence of not a specific effect of BCG vaccine were shown more than 15 years ago in studies done in Guinea-Bissau and Denmark.
Cabo Verde received the protocol of clinical trials that aims to study the use of the BCG vaccine to reduce unplanned absenteeism due to illness of healthcare workers during the COVID-19 pandemic. It was a multi-center randomized control trial that was aimed to be done in 3 different African countries, Cabo Verde, Guinea-Bissau, and Mozambique. The national promoter of the study was the University of Cabo Verde, and it has as partners University from Portugal and Denmark. The University of Cabo Verde submitted the protocol for approval in the National Committee for Ethics and Health Research. The protocol was also submitted to ERIS, informing of the project and requesting its position on the use of the BCG vaccine in the scope of the study. The protocol was analyzed by both the entities.
In 2020, a protocol was submitted to the Ethical Committee of Guinea-Bissau related to study on BCG, effect of BCG in COVID-19. And the approach to approval was following the following steps: relevance, pertinence of the study, the compliance with the ethics of scientific research and ethical trials in humans, compliance with the requirement of the National Research Ethics Committee of Guinea-Bissau.
In Cabo Verde, we start by reviewing our national legislation. The decree law number 26/2007 that creates CNEPS states in its Article 11 that studies in human beings can only be started after the approval by CNEPS. This means that the committee could approve the study. By the other hand, the basic law of the National Health Service established that clinical trials are always carried out under medical direction and responsibility according to rules defined in a specific diploma. But this specific diploma on clinical trials was never created. So if our legislation established that clinical trials should be carried out always according to rules defined in a diploma that was never created, we think that this is legal impediments to conduct clinical trials in Cape Verde. Additionally, not having this specific diploma means that we don't have a national legislation that defines all the stages of the clinical trial, establish protective measures for the participants, and provide for civil, administrative, and possibly criminal liability in case of non-compliance. So even if the protocol is well prepared, providing for the observance of all the fundamental ethics aspects of an investigation in human beings, without these legal divides, Cape Verdean authorities wouldn't be able to effectively protect clinical trials participants.
So our decision was based on background to similar studies in Guinea-Bissau and other countries in the world by Banding Health Project researchers. On results of previous studies by Banding Health Project researchers. And on Banding Health Project as a health and demographic surveillance system with huge capacity of performing fundamental studies. So this protocol was approved and the inclusion in the study is ongoing now.
In Cabo Verde, after analyzing our legal background and consider the legal impediment that we were faced and possible consequence of authorizing a clinical trial without having the means to protect the participants, both entities concluded that there are no conditions for legally conduct clinical trials in Cape Verde. So the decision of CNEPS, supported by ERIS, was that the clinical trial of the use of BCG vaccine in this context, the context of the pandemic, COVID-19 pandemic, shouldn't be approved, and the protocol was not approved. So these are the fundamentals that led to different decisions in an apparently similar situation. A case that shows that national committees for ethics can maintain their independence even in situations like this of a multi-center study. Thank you very much for your attention.
On behalf of the National Ethics Committee, I would like to thank the organizers of this event for giving us this opportunity to share our experience. Thank you very much.